Skudowitz. I'm the product line manager for the PACS and related products with Carestream. A bit about Carestream. Carestream's been a company since 2007. Before that was the medical division of Kodak. So as far as being in the imaging world, there's tons of experience and knowledge behind the name Carestream. And today we're going to talk about image sharing from the different use cases, or really from the different communities, because we feel that these different communities have different needs. And as far as image sharing is concerned, there are different challenges in each and every one of these. So when you talk about, or when you think about the radiology, the image sharing really came in when there was the consolidation of different enterprises in order to do enterprise reading, and then the physicians always want a single access point to their patients' information. And then today, what's the main topic is how do patients get control and management of their data. So again, it's not a single one solution fits all over here. It needs to be addressed through these different use cases or through these different communities. So if we go back a few years with regards to resolving the radiology area, we came up obviously with a number of challenges here. From the radiologist's point of view, if they need to provide reading services to a multi-site environment, obviously the first need is to be able to work out of one workstation, to work in a single environment without having to master and control and learn different systems. There's no compromise on functionality and tools that they need in order to do the interpretation, and this also includes dictation and reporting type tools that need to be available in order to bring them to the final report. And then there's also the element of providing a single work list so that you can work in a multi-site environment. So the true requirement over here was to provide an image distribution and reporting solution lifecycle in a multi-site environment, as if the radiologist is sitting in a single site, and this could be for PACSs that Carestream has, or for other disparate PACSs out there in the market. And we came up with what we call the UConnect, which is based on what we call the super PACS architecture, which basically virtualizes the enterprise or the multi-sites and allows radiologists to read studies from different sites using their existing workstations. You can see in the workflow over here, you may have a current and prior that arrives from two different locations. Obviously, in addition to having this information available, there's additional prefetch capabilities and push capabilities that can bring the information to the right place at the right time. But this is how that works. So there's a virtualized environment which can or cannot remove the pixel data as well. Then if we have a look at the referring physician community, what they really want to do is be able to have a single access point to their patients, to the patient's portfolio. Once again, regardless of where the patient went to. The challenges that you face when you come to address this community is, number one, that single point access. Number two is that you have no control over the systems that they're using out there. At least from the IT point of view and the radiology point of view, there is some kind of control over those workstations that are being used. But here it's a diversity of operating systems, browsers, network connections, etc. And then over here you also have the additional challenges of the security and privacy. You want to give referring physicians access to specific patients, to their patients only, not like the radiology world that can have access to a much broader. So we kind of came up with the requirement to provide an integrated on-demand and ad hoc system that will provide access to the referring community. And for that we came up with our ViewMotion product, which was targeted at the referring community. It's a zero footprint, and nothing's installed, nothing remains on the workstation. It's not, it's directed towards the image transfer information, so we integrate, we have different integration options into existing UMR systems out there, so this would be able to complement those systems. Okay, then we now kind of move into the patients. So here that's the need to be able to give the patients management and control over their information and what to do with it. Here the challenges that we kind of came up with are that the patients are mobile, they move from place to place, they obviously need their data or their information to be able to be available regardless of where they are. The traditional CD moving around had its advantages maybe at the time over film. Today we all know where we are with regards to that. The additional challenge that we have in this area is still the business aspect as to who kind of pays for services towards the patient. Is it added value? Is it on top of the CD or instead of the CD burning process, etc. So with this we came up with the concept of my view. This is my medical information data is available for viewing. So this concept, patients get registered into the system. They have the ability to view their data, and they also have the ability to share their information with other users of the system. It could be other clinicians for second opinion, family members, etc. That access would be controllable by the patient. In addition, just as a complement to this, any radiologist or anyone with the right permissions in the facility would also be able to take a single patient's study and share it with someone that may or may not belong to the entire organization. What's important, at least the approach that we took, is that from the viewing and challenges point of view, there's no system that fits all, but the policy that we took is that the back-end infrastructure is a single back-end. So we're not asking or demanding that the existing infrastructures or additional archives or additional systems be installed. We can kind of sit on top of that, and then from a business point of view, we are offering this as in-house cloud or on top of our existing systems or side by side with other existing systems, and then we do have our own cloud that we can put it into.